Hello and welcome to today's episode of Dr. Welling's Health Show. Today we are going to take few infertility related questions. Now we specialize in helping couples conceive naturally and we have been helping them from the last 24 years. We have successfully helped couples from over 108 countries and I have made a lot of videos on YouTube to help people couples understand what is the exact problem, how PCOS leads to infertility, how endometriosis leads to infertility, and a lot of other such videos. And at every video, I get a lot of comments or questions which the couple is finding difficult to get the answers for. So that is the reason why we are starting this series. And this is the first video in the series of question answers which couples want to know the answers for. So what we will be doing is we'll be taking around 10 questions in every video which I find repeatedly being asked by the couples and help them answer them or make them know the answer for. So let's see with the first question. We have been trying for a baby for over a year with no luck. All our reports are normal. What would be going wrong? Now, even if your tests are normal, there could be some reason why you are facing infertility issues. It could be egg quality, stress, or it could be just a wrong timing. Some imperceptible hormonal imbalances, undiagnosed PCOS, or untested, or when the reports are coming normal, but still you have something related to endometriosis. All these things will classify you under unexplained infertility by any specialist you go to visit for. And they will advise you IVF simply because they don't know the reason why you are not able to conceive. And that is the reason why IVF fails in couples like this. What you require is understanding of your past history, what is happening, and what is the reason of not getting conceived naturally. Now, personally or at Welling Clinic, we believe that most of the couples can conceive naturally. They has to be stimulated slightly with right homeopathic medicine or maybe nutritional support or few supplements which can help you conceive naturally within 5 to 6 months. Now, in such cases where there is unexplained infertility, there has to be found a reason why exactly you are not able to conceive. And what we have found is 2 or 3 most common reasons. One is the egg quality, then there is a continuous stress, there is sedentary life as in both husband and wife, they have desk job where exercise is minimal. So little changes in the lifestyle, some supplementary support and right homeopathic medicine can stimulate and help you conceive naturally without any IVF requirement. So let's go to the next question. My AMH is low and my doctor says IVF is the only option. So is there any way to improve my egg quality naturally? Yes. Now there are 2 things which low AMH signifies. One is of course the number of eggs which are there in your ovaries, and second the egg quality. Now whenever there is very low AMH, most of the IVF specialists will tell you to go for donor eggs. And such are the couples who come to us at Welling Homeopathy Clinic to help them conceive naturally with their own eggs. What you have to understand most importantly is till your AMH doesn't become totally zero, there are eggs in your ovaries which has to be stimulated, the quality of eggs has to be improved, and you will conceive naturally. That is the reason why a low AMH of up to 0.01 has conceived naturally at Welling Homeopathy chain of clinics in the last around 20 years. Number of females from USA, from India, from Europe have conceived naturally. Is only homeopathy necessary? No, many times nutritional support, right supplements, again every day walking of 20 minutes or gentle exercise can also help you improve the egg quality. When the patient comes to us, of course, we suggest to go under our homeopathy assisted reproduction therapy to help you conceive fast within a time bound period of 6 months. The next question is, can stress alone stop me from getting pregnant, even if all my tests are fine? Yes, absolutely. Lot of stress nowadays leads to hormonal imbalance. The hormonal imbalance which is not able to be identified in tests. So in the tests, laboratory tests, your hormonal levels will come normal. But they're imperceptibly high or low. You have a problem with thyroid hormones, which is stimulated by continuous stress. You have irregular periods, due to which there is less thickening of the endometrial lining, which can lead to difficulty in conceiving. And if you go for IVF, it becomes very difficult for So this also leads to difficulty in endometrial thickening formation, which can lead to implantation difficulty even if you go for IVF. So that is the reason why we don't ask patients to go directly for IVF. Try some other means. Try nutritional support, you can lifestyle changes, and of course you have Ayurvedic homeopathic treatment, which you can do your own research online and see for a specialist and visit us. If you would like to have direct personal consultation with our experts, you can of course call the number on the screen, talk to our experts to see whether our treatment can help you conceive naturally. We have a treatment cycle of around 6 months, which we have a success rate of between 68 to 72%. Coming to the next question, I have PCOS, but my periods are regular now. Why am I still not getting pregnant? In PCOS, the most common reason is irregular periods. But when you get regular periods and still not conceiving, understand that your cycle can be anovulatory. By anovulatory, we mean that the egg is not getting released. So you feel everything is perfect. You have PCOS, but you're getting your cycles regularly. Your bleeding is around 4 to 5 days, even 3 days is normal for that. But still you're not able to conceive for a year or 2 years. Here what is happening is, during your every cycle, egg is not getting released due to hormonal imbalance caused by PCOS. So once we know this root cause, any doctor will try to treat the imbalance which has caused by PCOS. Once your male hormones, which are increased during PCOS, goes down and you have start getting egg release during every cycle, you will conceive very soon. That's the normal treatment line which is followed in homeopathy assisted reproduction therapy at Welling Homeopathy clinics. Next we will see the question, 6th question for the day. My husband's sperm count is low. Can it be improved naturally, or do we need to go for IUI or IVF? Now in many cases, sperm health is the most common cause which leads to causing infertility. Female reasons are usually normal, or female health is normal, getting regular periods. Sperm count can be low or very low. Now what we feel is whenever it is 20 million and above, or slightly less than 20 million, you can conceive naturally. Now what happens here is, whenever a couple is not able to conceive for over 2 years or 3 years, and they visit an infertility specialist and they do a number of tests. Here when they are doing the test and they come to know that your count is slightly low or below 20 million, they say, yeah, that is the reason you are not able to conceive. And they put that idea in your head, saying that is the cause why you are not able to conceive. And then they push you for IVF directly. Now mind you, there are cases where IVF is the only option when the sperm count is very low or there is abnormal sperms. But when the sperm count is slightly low, you can conceive naturally. You require treatment like IVF, homeopathy assisted reproduction therapy, or any other therapy which you see or read about online can help you conceive naturally if your count is very low. slightly low, you can conceive naturally without any help. Just don't take the stress about conceiving, because stress is causing hormones to get imbalance. And once you're under the pressure of conceiving, conceiving becomes difficult. So if your sperm count is very low, below 5 million or 10 million, it can be increased with medicines. You don't have to directly go for IVF treatment. We have to find the cause. We have to treat the production of your sperms. We have to see whether the speed or the motion of your sperms is normal. Because if the motions is slow, motility is slow, that needs to be treated. Morphology has to be checked, whether every sperm has proper head, body and tail. These are the most common causes where conception becomes difficult, and that can be treated with medicines. So you need not worry when your sperm count is less. When it's slightly less, you can anyway conceive naturally without any treatment. Surely you can conceive. And when it's very less, you can take a help of homeopathic treatment, some nutritional supplements, some dry fruits like walnuts can help. You have a lot of information online which can help you increase your sperm count. Mind you, if there is some problem with your morphology or motility of your sperm, you require treatment. You can take homeopathic treatment, you can take allopathic treatment, any treatment that pleases you. If you have any query regarding this and you would like to get personal view on your count, and if homeopathy can help you conceive naturally and increase your sperm count, sperm motility and sperm morphology just with right homeopathic medicine with our proven treatment protocol, you can talk to our experts by calling on the number on the screen. Come to our next question now. Every month I feel like I'm pregnant, but my period comes late or early. Could this be a sign of hormone imbalance? Yes, especially if you're also having symptoms of bloating, mood swings, fatigue, tiredness all day, no mood to do things, and especially a lot of mood swings happening during your periods or otherwise also, it can be a sign of slight hormonal imbalance. Mind you, as I told you earlier, your hormonal imbalance every time is not caught up in laboratory tests. So only on symptomatically you need to be treated. You cannot be given hormonal medicines. You need to be given natural medicines to balance your hormones, to increase your egg quality, and that way help you conceive naturally. Coming to the next question is, I am 35-year-old and trying to conceive. Is it too late, or can homeopathy help boost fertility at this age? 35 years is not late at all. You can conceive naturally. But if you have been trying for over 2 years and not able to conceive, I would suggest talk to our experts. We would need to explore if there is an issue which is hampering the pregnancy. If nothing is hampering, we could even then give you some medicines that can help balance the reproductive system and help you conceive within 6 months. So talk to our experts. But yeah, do you require treatment in all the cases which are above 35? No. You can conceive naturally above 35 without any help. Just have some patience, have confidence, and you're good to go. Yeah, another thing is give your body enough rest, good sleep, add some vitamins like vitamin D supplements which can help you conceive faster, improve your immunity, and start any folic acid supplement. If you're talking to our experts and you are starting our treatment, homeopathy assisted treatment, of course all these things add up in the treatment itself. Our experts will help you. I will help you if required to get right supplements, right nutrition, and conceive naturally. We have clinics in Mumbai. If you are outside Mumbai and Surat, you can still consult our experts, because we have a complete setup of online consultation where we have helped couples from 108 countries. They consult our experts online through video consultation, send the reports. Some reports are advised by our experts to get it done more, and the treatment starts after a detailed pre-treatment assessment by our specialists and experts, post which or after which we ship the medicines to your address and continuously is in touch with you once every month at least to check the progress. Let's see the next question. This we have already discussed, but let's see what the couple is saying. My doctor says I have unexplained infertility. What does that even mean? Should I keep trying to get pregnant naturally? Unexplained means the routine tests which are done by a doctor or a specialist is not able to catch the exact cause in you. Obviously, if you are too much stressed out or there is problem in egg quality, it's very difficult for laboratory tests to catch that cause of infertility. If there is minor imbalance of hormones, if there is slight irregular menses, or probably there is lesser thickening of endometrial lining, this all can lead to something called as unexplained infertility. Tests are showing normal, but you are not able to conceive. There is very less treatment options in allopathy for this, and preferably they will suggest you go for IVF as a first option. And what we have maintained consistently for the last 24 to 25 years of our specialty practice is IVF is required in lot of couples, but it should not be a first option. You are meant to conceive naturally, and you will conceive naturally if given the time, the right treatment, medicinal treatment to stimulate the problem and cure it. You should be able to conceive naturally. So, unexplained infertility is simply where the routine tests are not able to catch the exact cause. In homeopathy, we treat the root cause whenever we find it. Otherwise, we give the treatment in such a way that it balances the hormones, balances the reproductive system in a female to help you conceive naturally. As I said, if you want more details, call the number on the screen, book a personal appointment with our experts, and clear all your doubts. And the last question for the day is, can homeopathy help someone who has been trying for 3 to 4 years, even after failed medical treatments? Yes, for the last 2 decades, over 20 years, we have been helping couples conceive naturally who have failed other medical treatments, who have failed IVF treatment, ICSI treatment, various other treatments they have taken through. Some of them have taken treatments for multiple cycles, 5 cycles, 6 cycles. And as it happens usually, as a last option, people would like to think of homeopathy. But we are there in this field for the last 2 decades, helping couples from over 108 countries and most of the cities in India. Couples will have conceived naturally, having their own baby with their own sperms without needing the donor sperms or without needing donor eggs. We have helped them. We'll get our success stories, which are over now around 5,000 to 10,000 cases on our website. We have video testimonials for increasing your confidence. As I said, we have a treatment cycle of 6 months and we have a success rate close to 68 to 72%. You might require more than one cycle sometimes if you are about 38 or 40. But for that, you need to talk to our experts, show your reports, discuss your queries, and let our experts or me guide you for the next step in the treatment. If you have more questions or any other question regarding your infertility, regarding your failed IVF treatments, if you don't know the cause of it, either you can put in the comment section and I will answer them in my next video in this series. Probably it will be coming next week. Or call the number on the screen and book a personal consultation so we can talk directly and clear your doubts. My expert team of specialists are waiting to help you conceive naturally this year. Bye and see you in my next video.